We continue with our Taking Action for Your Parents campaign now in week 4. The focus is on mobility. From subtle changes in the inner ear to the obvious back pain, these can have devastating consequences for our aging parents. Health reporter Linda Hurtado talked to experts this week about keeping seniors mobile and active and dealing with hearing loss. And you can see all of those special reports online anytime by visiting abcactionnnews.com/yourparents. We want to welcome to our studios this afternoon Dr. Frank Bono, who is from the Biospine Institute. Thank you so much for coming in.
Thank you very much.
It's so nice to meet you. One of the things that we've talked about throughout this campaign is the changes in technology and how it's helping medicine and treatment and all these different things. And yet, when you talk about back pain, people hold on to those old stereotypes of the recovery and what's it going to be like.
Right.
Based on your experience, what are some of the new things that you've seen?
Well, you're absolutely right. You know, people are holding on to the bad things, the bad outcomes that were out there and are still out there today. The new technology today is amazing. What has happened over the last 10 or 15 years, we're doing everything minimally invasive. So what that means is you have very small incisions, but what really is the most important part of it is what happens underneath the skin. We're not having to cut the muscle or burn the muscle. We're dilating the muscle, so we're preserving all that tissue, and we're able to get down to the spine with minimal destruction and taking care of like these little disc herniations and actually doing spinal reconstruction through these little minimally invasive techniques.
I hear you say these big words and then say minimally invasive surgery, and it just doesn't seem possible.
It is amazing. You know, the stuff that, you know, 15 years ago that we're having to do traditional spine surgery where you'd have to make these large incisions and taking, you know, burning all the muscle and just the recovery time, patients staying in a hospital for 3 to 5 a week and the infections, they're all going away. You know, everything is being done through these little tubes and pushing the muscle away, and it's very clean. Patients are going home the same day, and recovery is very, very quick.
So for the adult child who's trying to really take care of his parents' health needs and be an advocate for them, what would you say is the clear distinction between your parent having just regular problems that come with aging and maybe having something really serious that needs to be looked at?
You know, I'm a son. I have a mother who's in her 80s, so this is something that I always look at. You know, what do I do for my mom? I have the benefit of being a spinal surgeon, but for those people that don't have the benefit, you should look at, you know, is my mother, my father, are they getting up okay? Are they walking okay? Are they unsteady on their feet? You know, and it's not always a spinal thing. It could be an inner ear problem, like the otoliths that aren't balanced. So we kind of have to look at, but for a spinal problem, usually we look at, you know, is mom or dad leaning forward? Are they walking with a wide base gait? Are they unsteady? Those are the things that are a little concerning, and if they're experiencing that, then you should go to your primary care physician and ask them, you know, hey, can you get us in to see a spine surgeon?
Thank you so much. That's a lot of great information. We'll continue the conversation on Facebook, so join us on that. If you would like more information from the Biospine Institute, you can call them at 844-222-SPINE. That's 844-222-77463. You can also visit them online at biospineinstitute.com. Remember, come on back on Facebook for more information with Dr. Bono.